everyone, welcome to my page. My name is Dr. Nkiruka Bridget. Today we'll be talking about uterine fibroid. Why I want to make this video is that I watched a video. I may or may not put it in this video because of copyright issues. I watched a video where a pastor was telling the congregations that uterine fibroid is because of enough spermatozoa that they have deposited into that woman. Maybe because she was doing things about runs, or that she has had some sexual intimacy with people and they deposited. Even if the one they deposited 10 years ago, all of them will stay in the uterus and form uterine fibroid. OMG. Please. There's nothing like that. I'm a consultant obstetrician gynecologist. I have come to refute that claim. There is nothing like uterine fibroid coming from the position of spermatozoa. There is nothing. It is totally false. Totally medically false. Uterine fibroid is made up of smooth muscles and connective tissues in the uterus. It is called uterine fibroid. It is an abnormal growth of the muscles of the uterus. It has nothing to do with spermatozoa. Uterine fibroid affects women of reproductive age. It has nothing to do with how many men you have slept with. Please, it has nothing like that. And even the congregations were nodding their head as Papa is speaking. Papa is speaking. Please, pastors, leave the medical part for us. God does miracle. However, the etiopathogenesis, how diseases come about, allow us to explain them. We read that in the beginning. When we read that, that is what will be all our life will be studying. Uterine fibroid is not from spermatozoa accumulation. Please, it's not. It's the connective tissues and smooth muscles and sometimes fibrous tissue mixed together. Just that growth, that uterus has lost its sense of growth and is overgrowing in some of those areas, and it comes out as uterine fibroid. The etiology of uterine fibroid is not known. What I mean is that the cause is not known. However, genetic factor has been implicated and is still being studied. Genetic factor means that what it means that if your family members had uterine fibroid, it's possible you will have uterine fibroid. It is familiar, it runs on the family. If your mother has uterine fibroid, genetically is implicated that you may have uterine fibroid. It has nothing to do with spermatozoa or number of people you have slept with. Someone that is a virgin can have uterine fibroid. Someone that has not slept with any man can have uterine fibroid. There's one thing with uterine fibroid. If there are risk factors to it, so among the risk factor is that number one, if you are a black race, you are black, whether you are an African or a black American, so far you are black, you are predisposed to uterine fibroid. If your family members, there's any family history of uterine fibroid in your family, you are at risk of having uterine fibroid. If you have not given birth before, we call it nulliparity. If you have not given birth before, you are at risk of having uterine fibroid. In fact, there's this saying that if there is no baby in the uterus, fibroid will stay. So how is that related to number of spermatozoa you have been exposed to? It has nothing to do with number of spermatozoa. If there's no baby in the uterus, something wants to occupy the uterus, and in this case, it is uterine fibroid. In fact, uterine fibroid affects reproductive age women. It means those that are still giving birth, those that are still liable, those that can still give birth, are the ones that are affected by uterine fibroid. Even to the 5th decade, that's about 50 years of age. People that you see uterine fibroid in old age are those that had it and enter into old age. It doesn't grow new in an older woman. So risk factors for uterine fibroid are also be implicated in chromosomal abnormalities, has also been implicated in uterine fibroid. It has nothing to do with spermatozoa. Those that are obese has also been implicated as a risk factor. So if you are obese, we that you are overweight, we encourage you to lose weight as much as possible. These are the risk factors for uterine fibroid. Now, we have different types. We have the submucous, we have the intramural, we have the serosa, we have the pedunculated. It can appear anywhere on the body of the uterus. So far, that is the uterus. Uterine fibroid can live there. So far, you have not given birth before, uterine fibroid can be there, even if you have given birth before. So we encourage younger reproductive women to give birth in their 20s. Because after 20s, about 28, 30, it will be talking about uterine fibroid in their uterus. And it's not about the number of men or women they have slept with. There is this story of anything can happen. Even a friend knows a friend that was a virgin, has never known any man, and she had uterine fibroid. In fact, the first surgery that was done for that my friend's friends is because of uterine fibroid, and she was still a virgin. So you can see it has nothing to do with spermatozoa or the number of spermatozoa. You can watch that video. You can get a link and watch it again. So that is that. If it's in the submucous, that means it's in where the baby lies. If it's in the muzzle, that is intramural, muzzle of the uterus. If it's outside the uterus, that is serosa. If it's pedunculated, it can migrate itself and attach in any other places. Uterine fibroid can appear anywhere on the uterus, and it's not about how many men you have slept with. That is one of the things I want to disclaim. Now, the second thing is this. Uterine fibroid may or may not cause infertility. There are a lot of barrage of things that can cause infertility. However, if we have looked and we did not see the cause of your infertility and it's only fibroid that we see, we can go and remove it. And most times, if someone is going for assisted reproductive technology, that is IVF or IUI, we encourage that any fibroid in the uterus should be removed so that that procedure can perfectly go well. That is that. What is the treatment for uterine fibroid? It can be conservative management. If the woman has no symptom and the fibroid is small, most times we leave it alone. We leave the fibroid alone. It is the hormone of the woman that feeds the fibroid. Have you ever seen a man that has fibroid? That is one. Then the second thing is that if the fibroid is disturbing the woman, we can go and remove the fibroid. We can remove it through laparoscopic means, just laparoscopy, minimal access surgery, or we can remove it through open surgery, laparotomy. Anyone you choose, we remove it, depending on the equipment available and the skills. Then you can use what we call uterine artery embolization. This one radiological. You use ultrasound. You put something that goes there to burn off the uterine fibroid. You can do high intensity focus ultrasound. You just use ultrasound to send high wave on the fibroid and burn it. You leave it and it will shrink on its own. Then we can use drugs. Drugs is for those that are not fit for surgery. Drugs is for those that are about to enter menopause. So you see, this one is about to enter menopause, and the hormones feeding the fibroid will diminish. So the fibroid will certainly diminish and grow down. So if the woman is about to enter menopause, most times we leave the fibroid alone. Then other things that can be done is removing the entire uterus. For someone that the fibroid is so huge, so fibroid has distorted everything, and we cannot salvage any of the muscles. If you say just want to do myomectomy, the person may bleed to death. Or someone that has completed her family, you remove the uterus. These are the treatments for uterine fibroid. So you see, uterine fibroid has nothing to do with number of men you have slept with. So please send this message to that pastor. Share this video. Let people be aware of their health. Thank you. If you are not subscribed to my page, please do so now. Subscribe at Dr. Kiruka Bridget on YouTube at OBGYN Talks with Dr. Dazayo. Follow my page on Facebook, Instagram and TikTok on OBGYN Talks with Dr. Dazayo. I discuss everything about women's health, children's health, and sometimes men's health. See you next time for another enriching episode. See you.